It's my proud privilege to welcome our dear friend, Dr. K Rana. He's going to be the speaker from ASQA. Dr. Rana needs no introduction, the CEO of the Quality and Accreditation Institute. It's a long CV. To cut short, let me present Dr. Rana to you, CEO, former CEO of NABH and director of NABH, board member of ISQA, ASQA, and several international boards. He's published widely. His passion is what interests many people, which is doing different things differently, and that keeps him motivated, and he certainly does different things differently. Over to you, Rana sir, and we want to listen to your talk on point of care testing. Over to you now.
Thank you so much, Dr. Lallu, for kind introduction. Good evening, ladies and gentlemen. It's really an honor for me to be here, present amongst a galaxy of experts. And I have been hearing for the last few hours excellent presentation from excellent experts. So thank you so much for giving me this opportunity to share my thoughts on point of care testing and critical care. And I think I'm one of the odd men out. Most of the speakers prior to me were, all clinical experts and talking about intensive care and many other aspects of care. Thank you. I'm just briefly going to talk about POCT in critical care. Perhaps we might be knowing, of course, we keep talking about POCT. I've taken a definition for the house that testing that is performed near or at the site of a patient with the result leading to possible change in the care of the patient is the definition from International Standard ISO 22870, which is a standard on point of care testing requirement for quality and competence. And POCT is widely used nowadays in emergency departments, routine monitoring in wards, in operating rooms, and of course in critical care. So POCT ranges from basic measurement of the blood glucose to blood gas, which is one of the most sought parameters, VGA analysis, and to complex some of the viscoelastic coagulation assays, which includes a different blood clotting pattern to find out respective protein which is responsible for clotting and do the analysis and taking care of the patients. So in emergency department, we use POCT for rapid test results to make a prompt decision because patient has entered into the ER and require quick resolution of the problem, and therefore at times POCT tests are used for analyzing the risks and deciding on the treatment protocol or the protocol for the next level of care which patient required. It also used in routine monitoring in wards when patient is shifted to room or the wards for routine monitoring of the progress on certain parameters if they fall into the category of POCT tests which are covered under this. Of course, in critical care and as an operating room as well, at times we need a quick testing on certain parameters to see how the patient is faring on as far as the care is being given to the patients. And also it is used for continuous monitoring of specific biochemical parameters because under ICU in critical care, the patient is under monitoring around the clock and different parameters, including vitals, are being monitored. And therefore, at times, depending on the clinical needs, certain tests need to be performed to continuously monitoring the care and the protocol which are being delivered to see the progress in terms of the care plan has been decided. So in terms of benefits of POCT, of course, one of the most critical benefit, which is a quick turnaround time compared to the conventional laboratory testing, which you dry sample and send it to the lab and they test it and send back the results to you and clinicians to make decisions. So it's quite quick in that comparison. And in comparing to the conventional testing, there are still less chances, a number of errors because pre-analytical process is minimized because it's done there at the side of the patient itself. So collecting, doing the phlebotomy and labeling, and then storing, transporting, testing. So all those pre-analytical stage has been minimized and therefore reducing the errors because we know over 60% errors happen in pre-analytical stages. However, as the complexity of treatment and care is being increasing in critical care, the pre-analytical stage is also becoming more and more relevant as for the conventional testing. And of course, the requirement of less volume of the blood is definitely there in POCT compared to the conventional testing. But as we talk about POCT, it looks very nice that yes, things can be done quickly at the site of the patient care, but it's not that easy as well, because we have to really look at how serious we are about it, how significant decisions we are going to take based on these results. And therefore, it is important that we really put our quality control process in place. So as I mentioned, pre-analytical process, they are minimized because samples are then and there at the bedside, the near the patient. But of course, in the analytical phase of testing, it's really important to give careful considerations of different parameters which lead to either wrong or right results. And of course, post-analytical is also a less complex compared to the conventional testing, because the results which come out through the analyzers or any medical device immediately noted down in the patient records, because patient records does exist at the site of testing, compared to the conventional where the results are taken from the devices, the machines or equipment, and then recording a register, then transcribed on transcription into a test report, and then into a computer system, and then into a test report, and then reaching to the patient site. So definitely it's very important for giving due consideration for quality control to ensure the results coming out of POCT are reliable and credible to take the decision for the care which patient is receiving. And for that, the equipment plays a very important and critical part. And so equipment include any analyzer which are being used for POCT, or maybe any medical device which is being used. So maintenance of these equipment and the appropriate calibration to ensure their proper functioning is very, very important. And on top of that, it's not just equipment, but the people, the staff you are handling need to be competent to use that equipment appropriately. And therefore, their competency, their appropriate training is required, because compared to a conventional medical lab where people are really trained on handling equipment, their maintenance, their calibration is different than there. So the situation is really different, and therefore we really need to put more emphasis on the people who are using these devices or equipment or analyzer, as the name you gave, for doing the testing. And a periodic review of equipment and devices which are being used for checking to performance for the defined performance criteria. Very simple example, like we use glucometer, So using the glucometer looks very, very easy, but where there are a lot of variations depending the uses and depending on the maintenance. In case like you're using the old battery, you're not changing the cell of glucometer, so you're bound to get some errors in that. And even the results which come out of the glucometer is the variations, accepted variation by the manufacturing device. Literature is already given like plus minus 20% or so 25%. And therefore, it looks very, very easy to get the reading out of the device's display, but the reading which is reliable or not, it really depends on how you are really maintaining the device. It's not just that's using the device. So therefore, it's very important to give due considerations for quality and performance checks for these devices. If you really move on to more in-depth know-how of how you really ensure that the quality of results which you get out of point of care testing methodologies, one can really think of using ISO 15189, which is an international standard for medical laboratories quality and competence, which is used for accreditation world over by different accreditation bodies. But in addition to that, there's another standard which is specific for point of care testing, ISO 22870. But the beauty is that these two standards are 15189 and 22870 has to go together. They can't be used in isolation. So if you really want to include quality management system in POCT, then you first use ISO 15189 and then couple up with 22870. And if you really want to do that, so you really have to do some work. So the POCT provider, which is really thinking on implementing the requirement of 22870, is actually become responsible for the provision and ongoing management of all POCT by an assigned skilled staff member and or team. Because as I mentioned just earlier that in POCT, say in ICU, the ICU staff is using these devices or equipment for testing. They are not the regular staff of the laboratory. But if you really employ 22870, it's required that there should be someone assigned, which is a skilled staff, a single member or maybe a team responsible for doing what's going on in relation to POCT in critical care. And this is because to ensure that all POCT work is performed according to the requirements of ISO 15189 and 22870. And what it asks for basically implementing quality management system as per its defined policies and procedures is also require the requirements for personal competency, qualification, experience, monitoring. It also required for equipment maintenance, calibration, performance checks. It really requires for appropriateness of accommodation and environmental conditions for that specific equipment which is being used for POCT, and definitely for examination methods which are being used. And mostly devices, they comes with the references from the manufacturers, but are they reliable in terms of validation, whether the device which is being used for POCT is really got validated using a conventional method to cross-check whether the results coming out of that equipment are reliable as compared to a conventional testing. And of course, quality assurance methodologies for further ensuring using in participation in proficiency testing, participation in other quality assurance programs like retesting or rechecking of samples within a very short period of time, and also a variation by different staffs. And all three stages of testing, pre-examination, examination, and post-examination, all three stages need to be really given due consideration for appropriateness in terms of uses. So some of the key points which we really need to understand if we are really want to make sure that the results which are coming out of my POCT testing, which I'm using either for continuous monitoring of my patient or using for any reason for, we must use very carefully. And there is no doubt and no opinion on second thought that POCT is an excellent tool to support quick clinical decision-making process, to decide on choice of treatment protocol based on the quick results which you get out of POCT, and also to continuously monitoring the patient conditions and make choices and decisions for whether to continue with the same protocol or need to change. And it's going to be playing a key role in healthcare delivery in future, in just time to come, to improve access to healthcare. And we talk about, how accessible healthcare is, not just first access, but also the access within the healthcare facility to get the required care. And it's going to increase efficiency. Of course, the new thing coming up is the molecular POCT for common pathogens in ICU patients, which gives very quick results compared to the conventional bacteriology when you go to a microbiology app. But one thing is that POCT is not a replacement for conventional laboratory testing, but certainly is a supplement. So I think in high time in changing technology, changing scenario of clinical protocols and methodology, is really good to use POCT for quick turnaround time, making quick decisions of clinical care, and really take care of the patient in trauma conditions and emergency conditions, and even on continuous monitoring in ICU. So I think this is high time that we all professionals in critical care must use of current technologies, methodologies of POCT to make our decision quite handy and friendly with the best interest of the patients. So thank you very much for giving me this opportunity to talk about POCT, though time is limited. So I thought to be very brief, crisp, and I hope it was make some sense to all of you. Thank you very much.
Thank you very much, Dr. Rana, for that very lucid presentation. And I particularly liked the last slide that said POCT is not a replacement for conventional laboratory testing, but a supplement. and I think you covered it all. Thank you, Dr. Rana.